The National Lotteries Authority introduces the Lotto app for all Android and iPhones. Your free download available at nlasvg.com. Whether at home, work, or simply having fun, get all NLA game results at your fingertips. View all draws of the National Lotteries Authority on your handset or tablet with the user-friendly Lotto app. Download today at nlasvg.com. The Lotto app.
Good evening and welcome to this week's edition of Roundtable Talk. This evening we will be talking about monkeypox. The World Health Organization recently announced that it has become a global emergency. So to discuss that and more and where we stand, how prepared we are in St. Vincent, we have Acting Chief Medical Officer Dr. Roger Duncan. We also have the Chief Laboratory Technologist in Elliot Samuel and infectious disease specialist, Dr. Jose Davy. Okay. Okay, so to start us off, Dr. Duncan, a global emergency, there are just over 20,000 cases worldwide. How justifiable is this declaration at this stage?
Well, let's look at it this way, because I think some things we ought to consider first of all. The second meeting of the emergency committee, which is a committee of the WHO that looks at these things to declare them whether or not it's a pandemic or not. The second meeting was held last Thursday. The vote wasn't clear, so there was a sort of tie. The Director General then cast his vote in favor of a pandemic. Usually there are some things to be considered, whether or not this is an unusual event. Monkeypox is endemic in some countries in Africa. Today it has spread to over 70 countries where hitherto it was not seen. So this is an unusual event. And in just a couple of weeks, it spread to over 76 countries. So this is something that we need to consider. So it's unusual, it's unexpected, and there's international spread. We saw COVID, and we saw what COVID was able to do. The question is whether or not this could interrupt international travel and trade, which it could. My understanding is that no country has yet impose any travel restrictions or any testing or anything, but this could come at some point. Further than that, I don't want to speak for the Director General, but I'm sure he must have considered the stress public health systems have been under from COVID for the last 2 years. And I think these are some of the things that they considered in declaring it a global public health emergency.
Okay, so the question now, Dr. Davy. What is monkeypox?
So monkeypox is a viral illness, as in it's caused by a virus, a member of the pox viridae family. It is very similar to a disease called smallpox. Smallpox is something that's pretty much eradicated in the world, but if you were born in the 1970s and before that, you would have heard of it, the early 70s, and probably received a vaccine for smallpox. So this virus was found in Danish laboratory in 1958. That's when the first cases, were recorded, and the first human cases were recorded in 1970.
Okay. Are there different types of monkeypox?
Yes, there are about 3 or 4 serotypes. We know that viruses like to mutate. The word we'd use is change. And that's not a lot for a virus. So there are a few types that affects humans, 2 to 3.
Okay, and what are the symptoms of monkeypox? So if someone actually has it, what are the symptoms we should look for?
So here's where everything looks similar in the beginning. In the beginning, you have your regular flu-like symptoms, which is fever, headache, malaise, or what we call weakness. The difference with monkeypox compared to other diseases is that there are lymph node enlargement, and by that I mean, when the old people say you have a canal, the big boils, so you have those coming up. Whether by your ears, hair, or under your arm, you have a few coming up. And after all of that happens, usually 1 to 3 days of the fever, having the fever, then you start having a rash. This rash starts in your face, and then it goes for the whole body, generalized. So I think when people hear of a rash and what it looks like, they would be pretty scared. So first, it's flat, then it's raised like a little bump. It becomes filled with water, and then it becomes filled with pus. So the whole process takes about 2 to 4 weeks before the scab falls off of your skin and you're completely better.
Who is at risk?
So persons at risk would be the ones who are immunocompromised. Say, for example, someone with AIDS they're not on medications and they're not virologically controlled. People with cancer, those persons are at risk. Diabetics are at risk.
Okay, how do we test for this virus?
Well, as it relates to laboratory diagnosis and testing, there are several things that we want to take into account in terms of that really feeds into country capacity. We need to classify the agent first. We need to look at the biological classification. Monkeypox is really a category A organism, which really means that it's an agent that has a high capacity for morbidity, and it really has high public health impact. Having said that, Dr. David mentioned that there are 2 types. There's a West African clade and there's a Congo Basin clade. Most of what have been seen thus far is the West African clade that really has a low impact. I think the mortality is around 1%, right? That really feeds into sample collection. In country, we have been in response mode for a long time, and we have had a lot of things in place, particularly for testing for COVID-19. Systems that we can just rely on to easily build capacity for diagnosis for monkeypox. It's detected through a polymerase chain reaction PCR test, which is what we've been doing for a long time. And we have since acquired the probes, the primers, the master mixes to identify monkeypox, and we have had the training through our international partners, Pan American Health Organization. So at present, we do have capacity for detection. We have a lot of capacity for sample collection and transportation in country as well. And we are also reliant on our referral nodes, such as CARFA, CDC, who are ready and willing to assist us should there be any need for us to.
Okay, who should get tested?
Well, anybody who is a probable or suspect case, and I think Dr. Davey or Dr. Duncan can explain that.
Well, what we've done, though, because if we could go back a little bit, Teresa, to talk about what the public health emergency is of international concern and what it means for the member states of the WHO. Because, in fact, when the director declared this a public health emergency of international concern, the committee immediately issued what we call temporary recommendations, things that you advise countries to do, things that you need to get started so that you'll be able to deal with the pandemic. The first is to make sure you have resources allocated, both human and financial resources. We're just coming out of COVID. Well, we're still in COVID, actually. We're not coming out of COVID. I take that back. With everything else, I take that back. So we're still in COVID, and we have these resources already mobilized. And Elliot made an excellent example of the PCR test that we'll be doing for COVID now we could transfer to monkeypox. Our surveillance is heightened. Our ability to detect, Elliot, is great news, yes, that we could test up to today. From today, we could test. And we also been doing lots of contact tracing and testing for COVID-19. So that infrastructure is there. What we need to do now, though, is for all our partners in health, partners outside the health, which means the communities, ordinary people, to have this index of suspicion for the things that Jose's been talking about, yeah? An unexplained rash, then you need to find your healthcare provider You need to, you need to see someone. And what we've done in the initial sense is to make the definition of a probable case very wide. So if we make it wide, then we're going to catch lots of things. A lot of it probably might not be monkeypox, but we're not likely to miss a monkeypox case in this side. So the probable case is really very wide. So anyone who has a fever, unexplained rash with these lymph node swelling, please consult your healthcare provider immediately.
But these symptoms can also signal other things, dengue, for instance.
Well, not in its sterile sense. Jose would talk to that.
I think initially what people can confuse monkeypox with would be chickenpox. But if we were to roll things back, remember we don't have a case. So for us to get a case, it has to travel in. So there would also be that suspicion that I was in close contact with somebody who recently traveled in. So if that happens, then and people see a rash on themselves, they're really supposed to get really suspicious.
Okay. What does the actual testing entail?
Well, from a PCR perspective, we are actually looking for that specific DNA sequence, that specific code. So we're using probes and we're using primers to go in and look for that specific DNA sequence. So we're actually looking for the live virus sequence itself. It's not an antibody test, it's not an antigen test. We're looking for the live virus.
The live virus. Okay, we'll take our first break and come back in just a moment.
Here's your chance to win even more from the National Lotteries Authority when you play for 2 times daily. Choose phone numbers from 0 to 9 and you can win up to $5,000 with a $1 inline bet.
Makes 4 and back it up 2. That's right. There'll be lots of cash waiting for you.
Get your tickets Monday to Saturday for the Play 4 midday draw at 1:50 p.m. and the Play 4 night draw 9 p.m. So easy to play.
Play 4, you'll win even more.
Welcome back, Elliot. Just before the break, we were talking about testing, but how is the test actually done?
So I think we should step back a little bit to sample collection. For somebody who is suspected of having monkeypox, they will develop a rash or they will have what is called a vesicle, like a little boil. When we're collecting a sample to be examined at the laboratory, what you really want to do is to get the content of that boil, that vesicle, and it's usually a swab the doctor will use to push into that little thing. It might sound a little harsh, but you have to really get into it and get the content of that vesicle onto the swab. There are instances where the vesicle may have dried up, and you can harvest the crust as well. I think we like to call it a scab. Mm-hmm. So you can harvest that scab, and that can be put into a sterile container or into a viral transport medium and taken to the laboratory for analysis. Once it's there, it's going to cascade into a series of events that is going to eventually end up in us either detecting or not detecting the virus.
Sounds painful, is it?
No, it's not painful.
You sure? Okay, how is monkeypox transmitted?
So the transmission of monkeypox, there are 2 routes. There's the respiratory route, as in the droplets. So someone talks, cough, laugh, And if they have the virus, then it's spread out there in the air, and a susceptible person comes, gets it. There is also the route where if you are in contact with the liquid from the vesicles, then you can acquire the virus like that. Those two routes of
So those two
transmission.
routes,
Very
okay.
much the same like chickenpox.
Chickenpox. So how do we prevent transmission?
So prevention is back to everything we've been saying about COVID-19, about face protection, the nose area especially, and also the measures, washing your hands, all of the things that we've spoken about. I think people are tired of hearing everything that we have to say when it comes to that, but it really does hold through.
Is there also sexual transmission possibility as well?
No, the sexual transmission route has not been confirmed. But what is noted is that you have to be in close contact with somebody with chickenpox, with monkeypox to acquire monkeypox. So of course, sexual contact is very close contact.
And that's important, though, because one of the things we committed to in public health is to be doing these investigations, surveillance without stigma, without discrimination of people. And there's also always this conversation has started already. Well, you know, it's a gay disease, it's among homosexuals and men who have sex with men. And therefore, so we have to be very careful with this kind of conversation. As Jose said, sexual transmission has not been proven. Viral particles may have been found in semen, but to say that it's been transmitted through semen, that's not true. So it's the close contact that naturally occurs during sex. That is, you know, the reason for transmission and the reason for its occurrence among this group. Because we say that among this group because that's probably where it entered to come over. But that's, you know, it's not going to be always like that. It's not going to be sustained. It's not going to remain in this group. At some point, it's going to cross over. You know? I mean, look at HIV. We thought initially that it was related to certain sexual behavior, but it turns out not to be. Yeah? Because, you know, it's very rampant in heterosexual people.
Actually more.
More in heterosexual than in homosexuals. So. But one other route of transmission, though, is that people who are caring for people who are suffering from monkeypox, if you know, the soil lining, the beddings, you know, dressings that you might be using, you could also get infected from those also.
Should one be careful about going into largely crowded areas?
Well, in the context of COVID and now in the context of monkeypox, you should be. You want to avoid crowded spaces. You want to avoid areas where you can't have your 5 feet distance, areas that are not well ventilated. So we're talking about probably banks and supermarkets and public transport, yeah? So you want as far as is possible avoid these. And as Jose said, the same old things we've been talking about. Face, space, sanitize. And these are going to always help us. People don't like to hear vaccines. Okay, good, we understand. But we still be talking about vaccines. But, you know, if you choose not to take a vaccine, please, space, protect your face, and sanitize your hands frequently.
What about treatment for monkeypox? What treatments are available?
So very common to most viral illnesses, they're self-limiting, as in they would just go away in their space of time. Monkeypox has no specific treatment, so it's just about taking care of the symptoms. If there's a headache, you take some paracetamol, you hydrate. So the mainstay of treatment lies in that. Of course, there's some antiviral drugs that may help to shorten or not have the symptoms so bad, but the main course of treatment is just symptomatic.
Okay, and what about vaccines?
So presently in the US, there is a vaccine that's a combination one to treat smallpox and monkeypox, but it's mostly for the military population. It's not given to the masses. But I imagine, should we have such a spread, that they may make certain doses available to the public.
What specific plans or preparations have the ministry initiated or put in place should we actually have to handle monkeypox here in St. Vincent and the Grenadines?
So we start again, because we begin by saying that we've allocated resources, but those resources have been there. And we've been fighting the COVID-19 pandemic for the last 2 years. So they're there, they're sitting, they're waiting. We've had lots of experiences. If we were to sit and not have another conversation about COVID-19, what we might have been able to do better, we've learned a lot, okay? So in terms of the resources, we have those. And look how quickly now we've been able to build capacity for testing. It came just like that. And it came that way only because of the foundation that we had from COVID-19. Our surveillance is up, it's on par. We have public health nurses who are trained. We have people who are not even nurses, who have been carrying the brunt of the surveillance work that we've been doing. A lot of these are people who are out of the community college or the secondary schools, who we've taught how to do surveillance, how to do contact tracing. So we have those kind of resources. And of course, the issue of vaccines, currently, as part of the temporary recommendations, the WHO is recommending that vaccines be available only for contacts at this point. But vaccines are not, they're scarce. And they're also very expensive. And we're not likely to access these the way we access COVID-19 vaccines, through the COVAX or through the PAHO revolving fund. These are going to come directly from suppliers. And of course, the conditions would not be the same in terms of price, in terms of minimum quantities you could order, and minimum shipping quantities. So it's going to be a little difficult. So before we get a vaccine, we still insist that you have this suspicion, one, try and keep your distance, okay? I saw a headline somewhere today, I think, it's from one of the Jamaican newspapers, that people are advising to, limit your sexual partners to prevent the spread of monkeypox. The idea is probably a good one, but to talk about that, is again raising the issue of sexual transmission. It is that you want to reduce close contacts with strangers, people who you don't know, that sort of thing, so you keep yourself protected. So keep your hands clean, distance, be suspicious. If you see anything or if you think you've been exposed, speak to your healthcare provider.
How severe can the illness be, and people who are immunocompromised likely to be more ill than someone who isn't?
So per research, the fatality rate is roughly 1%. But of course, when data is published, it's published in context to a specific healthcare system. For our healthcare system, no one is far away from healthcare. So in some of these places, they would have been far away from a clinic or a hospital where they can get hydrated if they are dehydrated. So we have to take everything into context. The other thing that we have to take into context is that our society has never been exposed to something like this. So for me to predict upfront how ill people are going to be, we don't know. But judging from other viral illnesses, I do not suspect that it would be higher than the 1% predicted.
Okay.
And that 1% Josie's talking about, that relates to your West African clade, West
Yes.
African clade.
Congo Basin clade is
Right.
higher.
So, which is about 10%,
10%.
for the other clade.
Yes.
But bear this in mind. We saw this with COVID-19, the mutations. So you could begin with one, and then you'd probably end up with not just the second one, probably a third and a fourth and a fifth. And we always have to bear this in mind, because when it begins to mutate, the likelihood of us detecting it in this part early, it's not very good. So by the time it's detected in places where people are actually doing viral sequencing and genome sequencing, by the time they detect it, it's already pretty much, there's global spread. We saw that with the variants from COVID-19. By the time they detect one, it became the dominant one literally a week after, So we always have to bear this in mind. So even though the mortality is low, once it begins to spread among humans, remember this is a new host, never had this before. And it's an exciting opportunity for a virus, if it wants to perpetuate itself and live forever. It's going to keep mutating and try its best to live forever. So we have to keep that in mind.
Okay, we'll take our second break and come back in a short moment.
Play for.
Here's your chance to win even more from the National Lotteries Authority when you play for 2 times daily. Choose phone numbers from 0 to 9 and you can win up to $5,000 with a $1 inline bet.
Make sport and back it up too. That's right. There'll be lots of cash waiting for you.
Get your tickets Monday to Saturday for the Play for midday draw at 1:50 p.m. and the Play for night draw 9 p.m. So easy
Play
to play.
for, you'll win even more.
Welcome back. During the break, I was asking what is the difference between the West African and the Congolese virus? Is there any major difference between the two?
Well, they're just different strains of the same organism. One seems to be a little bit more deadly than the other, but they're basically the same thing, just different strains. Just like how when we saw COVID-19, we had the Delta and we had the Gamma and all of these things. Same organism, just different strains. As Dr. Davy was saying, sisters.
Okay. Testing capacity. What is it like currently?
Well, at present, we have capacity to do 400 reactions. And the reason I said 400 reactions is that every reaction don't translate into a test. When we do a test run, we have to think about how do we validate the run. So we have to put checks and balances in it, and sometimes they consume reaction as well. So if I'm going to translate that into tests, we probably might be looking at about 350 tests per se, which I think is a good starting point for us.
Okay, 350.
And what's the turnaround time on this?
Turnaround time, it's pretty good. I mean, we can get PCR results in about 2 hours, 2.5 hours. We have increased capacity at the molecular lab as well. We have put in a lot of instrumentation that's going to be, giving us results in a faster time. So we have automated extraction, we have liquid handling machines to be installed, but we have added thermal cyclers. We now have a thermal cycler in the lab with a capacity for 384 samples in a single run. Okay. So that has really boosted things for us there.
So your capacity or your ability to test for COVID will not in any way impact your ability to
test for monkeypox? No, as a matter of fact, we have actually just added more tests to the molecular laboratory. We can now do dengue on a molecular platform, we can do Zika, chikungunya, and we're going to be adding the respiratory viruses like influenza A, influenza B, and it will not really affect unless we have all of these things occurring in a pandemic state at the same time. It's not really going to affect us.
Okay.
And that is why when we throw the net wide, we're going to be catching not just the monkeypox, we're going to be picking up the Zika, the dengue, the influenza A and the influenza B also. Okay. So we'd have a better picture of what the public health landscape looks like in terms of pathogens.
Okay, I know we're talking monkeypox, but I guess we can, it's one system, one health system. Dengue, your capacity to test for dengue, how is that?
We can now do dengue on a molecular platform. Previous to that, we were doing dengue using serology, so we were checking for antibodies and antigen. With a molecular platform, it means that we don't have to wait on an incubation time and allow for the development of antibodies. We can now be testing people from day one. When you suspect that they have dengue, we can be doing that test from day one.
Okay, so for those of us who don't know, explain to us what is a molecular platform.
Okay, so whenever you are infected by an organism, the natural response for the body is to produce a fighting agent. That fighting agent is called an antibody. When we were testing for dengue before, we actually had to wait for the body to develop the antibodies, which is a response to the agent, so we can know that the agent was there. On a molecular testing platform, we are looking for the agent itself through DNA molecule. So it's like if Elliot commits a crime, you don't have to go looking for evidence that he was there. You're looking for Elliot himself. Okay? So that molecular fingerprint, which is that DNA fingerprint, gives us a higher accuracy level that the agent that you're looking for is the agent that you're finding.
Okay. Is anyone more susceptible, maybe I should ask you that, to contracting monkeypox?
So we're back to the immunocompromised persons. Their immune system, they don't really have a lot to fight. So if something, because mind you, the body is very intelligent. Not everything we're exposed to we actually get. So being exposed doesn't mean that you have to contract or actually succumb to a disease. And a lot of diseases have what we call the subclinical state, as in people, even though contracting the disease, they just would not show any sign or symptom. But the ones who would be more at risk would be cancer patients, the HIV patients, well, AIDS patients, because the HIV who are under control, they won't be at risk, the diabetics. Those would always be a risk category when it comes to viral illness and bacterial illnesses.
So if someone suspects that they have been exposed, what do you suggest that they do?
Well, immediately contact your healthcare provider, whether that's in the public healthcare system and the private healthcare system. We've done significant training already for public practitioners. We're going to do some training for private practitioners, which is mostly sharing what is our monkeypox manual with them. Case definitions, diagnosis, what you do, what you look for, and so forth. But you should get in contact, because the only way we're going to break the transmission is that we have to separate people who are infected from people who are not infected and prevent them from transmitting it to other people. So you stay away from everybody else, make sure you isolate yourself, get in touch with your healthcare provider, and you follow the advice.
Okay, I'm tested positive for monkeypox. What is the next step?
Well, where the lab is concerned, we're going to have to send that sample off to our reference lab in Trinidad, CAFA, and then probably springboard it on to CDC as well, because we have to confirm that it's really a true positive. That will cascade a set of events for the public health team as well.
Okay.
So you test positive, the report comes in, we will immediately contact you, tell you, well, okay, you did a test this morning, we have your test result back, your test result came back, you have indeed tested positive. Before that, however, the person who actually did your testing would give you the result, and the public health people coming afterwards, because there's confidentiality and privacy that we don't want to breach, yeah? We would advise you to isolate yourself. If you're unable to safely do that isolation at home, then we would make some provisions for you to be able to isolate safely in an environment that is safe, where where you don't feel threatened, where you could have your meals, you could have your hydration, sunlight, and exercise or whatever that you would need. That isolation period would go on for about 14 days or probably beyond. Yeah? Because this is all new in humans for this volume of humans. So we're still uncertain as to how long, okay, until the scabs are healed, right?
Yes.
Okay? So you'll do that. And we'll ask you then to go back to check how many persons you've been in contact with. So we want to establish when you start feeling sick. When did the fever first appear? When did you first feel a lymph node? When did the first vesicle appear? So you'll be quizzed on all of these things. And then we'll try to establish now who were your contacts. And again, we're looking for close contacts. So if we were on the bus together, you were the seat in front of me, you're not a contact. If you're behind me. But if we spend time together, then you are closely, then you're a contact. And we'll contact the contact to say, you've been exposed to monkeypox. We want you to self-isolate. Okay? Again, you will begin to self-isolate for 14 days. Until a rash appears. If a rash appears, then we can test that rash. If a rash doesn't appear and you have a fever, then we could do a nasopharyngeal swab. So that's one other way of testing. So we don't always have to do the scab, if the vesicle, if there's none. So once you're a contact and you develop a fever, then we could do a nasopharyngeal swab and test you then for monkeypox.
So the protocol, in a way, is similar to that of COVID-19?
Pretty much.
Okay. Okay. How concerned should we be in St. Vincent and the Grenadines?
Well, the message, from the global partners in health, look, don't panic. We don't need people to be unnecessarily worried. But we need you to know about this. Know what it is, know how it's transmitted, know what the symptoms are, so that you have this index of suspicion that it probably is happening to me or I might have been exposed. But of course, we don't want people to panic, and there's really no need for that either at this point.
You were saying that people should isolate until the scabs are healed? How long does it take for the scabs to heal?
It can be 2 to 4 weeks. It depends on the individual. So once there is a skin or a liquid oozing out, you're not free to leave that isolation. A matter of fact, people should isolate once there's a suspicion. You don't wait for the results, because if it becomes positive and you're still walking around when you got that result, you would have already exposed someone. So when the scab heals, then you're good.
Okay. We'll take our final break and come right back.
The National Lotteries Authority introduces the Lotto app for all Android and iPhones. Your free download available at nlasvg.com. Whether at home, work, or simply having fun, get all NLA game results at your fingertips. View all draws of the National Lotteries Authority on your handset or tablet with the user-friendly Lotto app. Download today at nlasvg.com. The Lotto app.
Welcome back. We didn't talk about an incubation period for monkeypox. So what?
So the average incubation period for monkeypox is 5 to 21 days, but the average is 7 to 14. So most persons from the time of exposure to becoming ill would be 7 to 14 days, but it can be as early as 5 and as long as 21.
Okay. So if I get tested, yeah, and it's been 10, 14 days, or whatever the period is, and that period is gone, and I get tested, would it show that I was infected, but I got better?
You're talking about the presence of the virus.
Mm-hmm.
Well, your viral load is going to fall off. I don't know how long it takes to fall off in terms of for monkeypox, but it tends to fall off as the infection progresses. So I suspect that by the time the vesicle are healed, 3-4 weeks in, then your viral load is going to be in undetectable ranges.
Okay.
Of course, final clearance for you to leave isolation would have to come from your health practitioner, whosoever the public health person that's following you and is taking care of your case. So you have to wait for that advice to be cleared.
Okay. Well, before we go, can we just let the public know what they should look for and what they should do and how much they should be on their guard?
Well, as we said, and Joseph spoke about, if you've been exposed to somebody who you think might have traveled or coming, sometimes these encounters are, they don't occur with a lot of light, so you're probably not seeing any rashes or anything, and you're probably not so sure. It could happen like that, so that could happen. But you have to think for yourself. On one hand, each of us as individuals have a social responsibility to everybody else living in the country to make sure that if I think I'm infected with something, an infectious disease, then I should keep myself away from other people and I should seek help. So we have that responsibility. And, it's a moral responsibility. It's something that you must accept that you have. So, it is not something for us to try to find every single one. Of course, we'll do our best to find every single case of monkeypox. But if you know you've been exposed, or if you see yourself developing the rash, you have a moral, social responsibility to inform, one, the healthcare provider, and to the people you've been in contact with. I'll say that for now, and then just probably add up.
I just thought of something that I should say. The fact that you see the rash, you shouldn't just run out into public and expose persons, because I know people might get scared that, oh, it's me, it caught me, and then it's in your face and they really want to seek help. But remember that the fatality rate is low, so you can stay in your home and make the calls and get help. And your family members, this is very important, how to care for someone at home with monkeypox. The same measures with using gloves. You wipe surface areas that are frequently touched. If the person can be placed in a room with their own bathroom, that would be great, but everything should be cleaned down. There's no reason for family members to panic. I know because it's the skin and the face, people would tend to scorn, as we would say, others. But remember, it can be anyone. And if it's your turn, you would want someone to help you as well. So it's just about the measures. When you're cleaning up, you wear gloves and you can put the linen. You have to put the linen separate when you're caring for them, the bed clothing and the sheets. That has to be washed separately. You can use bleach. So white sheets are always good. They have good reasons, right? And of course, proper hygiene, the person who is ill and those caring for them, hand washing. Cleaning surfaces with diluted bleach, and that's 1 in 10%. So 1 part bleach, 9 parts water. Make sure you're mixing it properly. Because if you pour just pure bleach, you would not get the properties that we're looking for to kill viruses. I know people think that, if it's strong, it's better, but you have to really dilute it well. Or if you think the area is really soiled, then you do 1 in 5, as in 1 part bleach, 4 parts water. That's for surfaces, not for skin, okay? So these are some of the measures that we need people to bear in mind when caring for others. Have the person wear a mask if they have to come out of their room. If you're going to be in contact in the house, then you should wear a mask as well.
Okay, and you have the final say, I think, today, Elliot?
I would just want to say that if you think that you are exposed or you're experiencing symptoms, backache, weakness, rash in your skin, don't just run to the lab. Not because you hear we have capacity. You have to actually report to your healthcare provider. And we all work in synergies. The surveillance team, the public health team, the doctors, we work together. So they will do all of the sample collection. They will advise you in terms of what to do, where to go. And the sample will get to us, and we're going to provide your results in the quickest possible time.
Okay, thank you. That's our program for today. Special thank you to Doctors Roger Duncan and Jose Davy, and also to Elliot Samuel. Thank you, and see you again next week, Wednesday. Good evening.